Good afternoon, and welcome to the second in a multi-part webinar series that Amazing Charts is hosting on the MACRA and MIPS quality program. My name is Christine Tremblay, and I'm the Director of Product Strategy for Amazing Charts. Today we'll be focusing on the MIPS quality reporting options and quality measure scoring. Thank you for attending. Our agenda today will be to give you a quick introduction overview to the MACRA and MIPS program. Then we'll dive into quality reporting options that are allowed under MIPS. We'll look at some specific quality measures that you may want to consider reporting on for 2017. We'll take a look at how your quality scores are going to be calculated. And they'll give you some reminders and some resources of what's to come under the MACRA and MIPS program. At the end of today's program, we will have time for a live question and answer session. You'll be able to type questions right into the GoToWebinar screen, and the Amazing Charts product team will tackle those questions during the last few minutes of the webinar. If we don't get to your question because we've run out of time, we will know who you are, and we will reply promptly with an answer to the question that you submit. Again, thank you for joining, and let's get started. We're here to help you at Amazing Charts. We want to ensure that you're successful this year and next year and in all the coming years against your quality program objectives. This webinar specifically will tell you about the ways you can report for MIPS, understand which method will work best for your practice, gain a deeper understanding of what registries and QCDRs do and what the benefits might be to adopting one. We'll talk a little about quality measures and how you might choose which ones you'd like to report. And we'll take a deep dive into the scoring and the potential outcome that may be a result of your score. Please note that if you missed our first webinar, which was focused on MACRA and MIPS 101. It is available on our website, and there's a link included in this program that can take you to that webinar if you need a refresher on the basics of the whole program. But here's just some basics now. MACRA stands for the Medicare Access and CHIP Reauthorization Act of 2015. Part of the MACRA initiative was to establish new ways of paying physicians. CMS calls these programs the QPP, the Quality Payment Programs. Physicians going forward will be paid under either the MIPS program, which is what we're discussing today, or under alternate payment models like qualifying ACOs, the CPC Plus program, and other value-based programs that are Medicare sponsored. We believe most Amazing Charts providers will participate in the MIPS program. If you have questions about whether or not your practice qualifies to participate, please check out our first webinar or the Resource Center on the AmazingCharts.com website. There are some exceptions if your practice is small and also based on the number of Medicare patients in your panel and the dollars that you bill out to Medicare. So you may in fact not be covered under MIPS, but take a look at those details. The new merit-based incentive system, or MIPS, is going to be based on 4 subject areas: the quality measures, resource use or cost, improvement activities you'll undertake in your practice, and a category called advancing care information, or the meaningful use of your EHR. The funnel on the right shows that the new MIPS program is actually a replacement of the existing programs that are in place today, including meaningful use for Part B physicians, PQRS, and the value-based modifier. Under the new schema, each category I mentioned of the 4 categories will be worth a certain amount of points that in total will determine whether your practice will get an incentive payment or a penalty against your Medicare fees going forward. As with all government programs, there is a rollout of this program over a number of years. As you can see, 2016 is the last year that you would file reporting for meaningful use, Medicare Part B, PQRS, or the value modifier. As you might be aware, those metrics are due to CMS in March of 2017. But going forward, your reporting will occur under MIPS for the period starting in January 1st of this year. So 2017 is considered the first performance year for MIPS, and skipping to 2019, you'll see that it will be the first year that your payment will be affected based on your performance, and in the first year would mean a potential 4% increase or 4% reduction in Medicare payments. Each year, the percentage of increase or decrease escalates, 5% in 2020, 7% in 2021, up to 9% in 2022. So January 1st, 2017 is the first day you could start collecting data for the MIPS program. You do not have to submit any data until January of the following year, and the deadline to submit will be March 31st, 2018. You'll continue to use Amazing Charts as it is today with our certified solution to track your progress for MIPS throughout the year. Towards the end of the year, Amazing Charts will be making available version 10, which will have a full MIPS reporting capability as well as updated clinical quality measures and a larger breadth of those for you to take advantage of. So we strongly suggest you be thinking about your upgrade path for the fourth quarter of 2017. We covered in our first webinar the choices that you have for participating in MIPS in 2017. Your first option would be not to participate. And in that case, you won't be worried about submitting any documentation, and you will automatically see a 4% deduction in payments starting in 2019. The next available option, and the easiest to meet, would be the test option. And here you'll see that there would be no negative adjustments nor positive adjustments in the test path. Under the test path, you would report one quality measure or one improvement activity or the 4 basic advancing care information measures. Let's assume because you've joined our webinar today that you may be thinking of a partial participation path. Under this choice, you could see a positive adjustment on your 2019 Medicare payments. It would involve reporting on between 2 and 6 quality measures and or between 2 and 4 improvement activities and or the 4 base measures for advancing care information and any performance measures that you achieve beyond that. The last choice would be to participate at full participation level. That would mean that you would report quality measures, all of the 6 required measures. You would undertake between 2 and 4 improvement activities, and you would complete the 4 advancing care information measures and performance measures for 90 days at least and up to a full year. So in the partial and full category, you'll be looking at a 90-day participation period at minimum. Please note, the MIPS program is budget neutral. What that means when CMS tells you that is that the total budget for Medicare payments overall can't be exceeded. So what that means is there is expected to be a balance between providers who will receive a penalty and those that will receive a positive adjustment such that it equals the existing budget. In that regard, there's no way for us to tell today exactly what your positive adjustment might look like. Your potential adjustment will be based on your total score. The score for 2017 excludes resource use or cost, and so only includes the categories we've talked about: quality, practice improvement, and advancing care. Today we'll only focus on quality, which is the largest slice of that pie, represents the most potential points you could earn, but is also the most difficult. Overall, the composite score balances to a 100-point scale, and CMS predicts that people who have an overall composite score of 70 points or above would be considered exceptional performers and could potentially receive additional bonus. Okay, so let's take a look at reporting options specific to the quality category. So here I've reiterated the pick your path choice that you may make. Under the test path, you would not be eligible for any incentive. However, you can avoid an adjustment and earn the minimum number of points for this category, 3 points, by reporting any measure for any time period. Under the partial option, you have the potential to earn between 6 and 60 points. You have to report for at least 90 days, and the reporting must contain 2 or more measures. One of the measures must be an outcome measure or a high priority measure if no outcome measure applies to your practice. Under the full option, where you could earn up to the full 60 points, you would also report from 90 days up to a full year. The required measures are the 6 measures that are required, or a measure set if you're a specialty. One of those also must be an outcome measure or a high priority measure if outcome measures don't apply to your practice. So as you can see, the longer you report for, the more likely it will be that you'll meet the reporting requirements and be able to be eligible for additional points under the quality category. So let's look at your choices for submission. We've limited our narrative on this part to individuals and group practices. You have the option of submitting via your claims. This is similar to how you could submit in the past for PQRS. However, under Medicare Part B, there's only about 75 available measures to choose from that are accepted via Medicare Part B claims. So this may or may not work for you. If you choose not to use the claims option, you have upwards of 240 or so available measures to choose from. You have the option of selecting a qualified clinical data registry. That's an entity that can partner with you to assemble the data that you need to report your quality measures and report them directly to CMS. For quality reporting under this method, you must include at least 50% of your patients, regardless of the payer. So Medicare and your commercial payers are included in this quality reporting exercise. You will report on any 90 consecutive day period or longer, and you must meet a case minimum. That means at least 20 cases must apply to your practice per measure in order to file and qualify for bonus points. There also must be a benchmark for the quality metric that you're measuring. At the end of December 2016, CMS released benchmark data for the quality measures that you'll be interested in. Those can be found on the CMS QPP website for your review. Your performance will be compared to the benchmark as one of the attributes of deciding whether or not you'll qualify for an incentive or an increased payment. You'll be able to report your measures using Amazing Charts version 10. This version would not be available until late this year. Therefore, if you're choosing to participate in the quality measure category for MIPS for 2017, and you want to continuously monitor your progress throughout the year, we still suggest that you engage with a registry to help you do that. You also have the option of qualified registries, and those follow the same criteria and also sometimes include quality measurements that may be applicable outside of the Medicare program and even for some private payers. So a qualified registry is an entity that collects the clinical data from your practice and submits it to CMS. They'll be able to report on the approved quality measures, and depending on what professional organization you may be a member of, there may be a discounted rate when signing up for one of these registries. A qualified clinical data registry is also a CMS-approved entity that will collect the data on your behalf and will allow you to monitor your progress continually across the practice, including disease tracking and quality tracking, and help you improve the quality of care along with the reporting services. Some of the practice improvement activities that are included under MIPS are centered around using a quality clinical data registry, and so you can receive extra credit under MIPS for adopting a registry solution. Many QCDRs that we have talked to plan to include the ability to attest to some of the other categories under MIPS, advancing care information and practice improvement activities as well. CMS plans to build a website that you can log into in order to enter the attestations required for these categories sometime in 2017, late in the year. QCDRs do make it easier to compare your progress against the national benchmarks so that you know where you stand on a continuous basis. So you may be wondering, given there's a long list of QCDRs, which one might be right for you? We've included a list in this presentation. You'll have access to the full information after our session. But based on your professional organization, there may be a preferred registry available to you. Cost will vary anywhere from under $25 a month to closer to $40 a month, but their benefits are outstanding. Here's a snapshot of what one of these common registries looks like. The data is intentionally blurred here, but each line represents a quality metric you may choose to track in your practice. And the color coding on the right-hand side of the page indicates how you're doing against that measure over a defined period and what the national industry benchmark would be. Lots of valuable information here and really designed for continuous monitoring and improvement of the quality of care in your practice. Let's take a dive into quality measures. Which measures should you focus on? The way you choose to report, in addition to your specialty, will help you determine which measures you can report on or should report on in the 2017 timeframe. Once you've determined how you'd like to go about reporting, you could take a look at the quality measures section of the qpp.cms.gov website, filter by submission method, choose your practice specialty, and that would give you access to the list of measures. Some examples of quality measures include for family practice, documentation of current medications in the record, and the regular preventative and wellness screenings that you've probably been used to doing for years in your practice. We've included a list as well of some specialty measures, particularly focused on cardiology here, around controlling high blood pressure, therapies for coronary artery disease, specialist reporting, and other measures. On the bottom left, you'll see an example of a measure set for rheumatology. This in particular could meet all of the reporting requirements that a rheumatologist might have for the entire year and mimic what was required under PQRS. We've included some examples of both outcome measures and high priority measures here so that when you're looking at the mix of measures that are required under the program, you can choose the ones that best apply to you. If you have more questions about measures and what we'll be able to support, please feel free to look at the CMS website or give us a call. So let's take a look at how your scoring will occur for the quality category. Quality represents the overall 60% of the composite score and is the most difficult of the three categories to complete, as there are a lot of details to track. Okay, so if you've decided that on the test category, what you're really doing is simply submitting a report to check the box. Submitting your report to check the box will enable you to avoid any negative payment adjustment or positive payment adjustment. So this slide assumes that you're going to undertake either the partial or the full pass. So under test, you would receive 3 points for quality. Single measure with a minimal number of points. That gets you, like I said, under the wire, no penalty, no positive adjustment. If you've chosen to do more, then each measure is worth up to 10 points total. You'll get the 3 points if you submit a measure that meets the data completeness requirements, and then the other 7 points will be calculated from your performance on that measure. You can only qualify for the possible 7 performance points if you meet the case minimum we spoke about, 20 patients, and data completeness, and the measure itself has a benchmark, which is why it may be important to look at that benchmark data on the QPP website or through the registry that you choose to make sure that it's going to qualify. So how do you get bonus points? If you do an additional high priority measure beyond the one required, you will earn an extra point in the quality category. And for each additional outcome or patient experience measure, you can earn an extra 2 points. So if your performance points are lagging a little bit behind, you could earn some extra points by filing more measures. So let's take a look at an example. In scenario 1, a measure has been chosen for reporting, but it has no benchmark. It does meet the data completeness standard and the case minimum standard, but the only points you would receive on that is the minimal amount of points per measure, which is 3. Under scenario 2, where the case minimum of 20 patients was not met, you would again only receive the base number of points for that, and that would be 3. And in scenario 3, the data completeness standard is not met, therefore still the minimum number of points of 3. And in scenario 4, where it's meeting all of the standards, has a benchmark, meets data completeness, meets case minimums, you would be automatically receive the 3 points and be eligible for a maximum of up to 10 points. So let's take a look at how we get there. As I mentioned, the benchmarks have been published with the decile information, and you'll see that the point scoring going forward starts really with a floor of 3 points. So you've met the standards, the 3 points have been earned. And then we move on to your performance on that to decide how many points you'll receive between 3 and 10. So the quality measure equation is that 3 baseline points plus 0 to 7 points gets you less than or equal to 10 points for the measure. So let's suppose that your score for that particular quality measure in question is 36%. You can see from included in the table included that 36% earns you an additional 2 points beyond the 3 baseline points that you got for meeting the standards, or a total of 5 points for that quality measure. So now let's take a look at how it might work if you've chosen the partial pass. This means that you have decided to report on quality for 90+ days. We're looking here at the diabetes hemoglobin A1C poor control measure. It's an outcome measure, which is one of the required measures you must submit. It meets all the requirements for the minimum 3 points. You as a practice have earned 22% on that measure. Again, this is an inverse measure, so this would mean that 22% of your patients are not well controlled. The number of points for that percentage that you would earn would be 8 out of the 10. You wouldn't receive bonus points on that measure, so your total would be 8. For breast cancer screening, which is a process measure, it's not meeting the data completeness requirement in this case. You can still report on that measure. Even though your performance may be at 85%, the number of points that you would be allocated would still be 3. And then if you reported on this third measure, controlling high blood pressure, a high priority measure, and you meet all the standard requirements for the minimum 3 points, you're scoring 68% on that measure. The number of points earned for that percentage would be essentially 2.9 plus the 3 takes you to 5.9, and you've earned a bonus point because you've decided to track a high priority measure, which takes you to a total score for that measure of 6.9 out of 10. So 17.9 points across the 3 measures in the partial pass, assuming 90 or more days has been reported. So to do the math for you here, the quality category score is 60%. That's what's represented at the top line. And they're going to divide the points you've earned by the possible points to get your total points for the category. So in the previous example, the 60 points each are worth up to 10. You decided to submit 3. You scored 8, 3, and 6.9 times the 60% that's required for us to get to the composite score. You've got 17.9 points out of the total 60 points possible. So let's look at that in the context of all the scoring. Again, just a reminder, our MIPS 101 webinar goes much deeper into the scoring for improvement in advancing care, and subsequent webinar series that we will conduct will take you through the ABCs of each of those remaining categories: improvement activities and advancing care. But for our purposes here, we're looking at a clinician, part of a small practice, who's decided to also report on the basic advancing care information measures and one medium improvement activity for a 90-day period, in addition to the quality score, which we just reviewed. If you add those weighted scores together, you end up with a 37.9 composite score out of a possible 100 points. Your adjustment from CMS is going to be based on this composite score. It's questionable, as we speak today, whether or not this score would earn you a positive adjustment or what level of positive adjustment it would earn. So we'll move on to wrap up with some reminders and resources. We're going to make this information available on our website and after this webinar, we'll be sending you a link where you can either rewatch the webinar, share it with colleagues, download the PowerPoint presentation that's been used for this session today. But we wanted to wrap up with some information about what to expect in the current months. So Amazing Charts is currently certified under the ONC with our 2013 certification. We are working on the current certification, or 2015 certification under ONC. The ONC had just last week finalized the number of the requirements, so we're working hard to complete all the new features that are required and to update all of the quality measures so that they'll operate seamlessly from within Amazing Charts. You can use the current version of Amazing Charts for 2017, though the quality measures in Amazing Charts are not up to date for MIPS reporting. So we recommend that you be at least on version 9.3 to get the most up-to-date version of the code that we have and to take care of other, take advantage of other beneficial features. We do strongly suggest that if you're looking at partial or full participation, that you engage with a registry partner in the coming months so that you can be assured that you can track and ultimately report if you're seeking a positive adjustment. If you'd simply like to report along the test option, or you plan to partially participate but aren't worried about whether or not it will result in a large positive adjustment, you're certainly able to wait for Amazing Charts version 10. However, you'll be doing some retrospective reporting of your quality measures against all the data that we're tracking in Amazing Charts for you, and there wouldn't be necessarily a guarantee of success. So for guaranteed success, we say go with a registry for this year only until we've gotten you the full reporting capabilities through Amazing Charts with version 10. Great. Where can you get more information? You can find out more on our website, amazingcharts.com. Under the support section, we have pages dedicated to MACRA and MIPS that include FAQs, publications, checklists for your practice. We really love the QPP site that CMS has built. It's very, very helpful for both providers and vendors to learn a lot of the details of what's required on the quality payment program and to look at specific to quality measures, the benchmark data that's just been published, and specialty-specific lists of measures that you may consider reporting on for 2017 and forward. We did briefly discuss claims-based reporting and reference that some of you may have done this under the PQRS program. It will be similar for MIPS, and we've included a link where you can find out more about how to submit MIPS quality measures using Medicare claims. Our future webinars are going to include MIPS advancing care information details, along with scoring and submission for that, as well as the MIPS improvement activities and scoring and submission for that. And those will be those dates will be published in the coming weeks. You'll also be invited via email because you've attended today. We would like to highlight that there is a CMS webinar tomorrow where they are also going to focus on quality. And you can log into that at 1:30 Eastern Time and register at the link we've provided in this deck. So now we'll pause for a brief moment and take some of your questions and answers. Oh, before we jump into the Q&A, we're going to display a poll question on the screen. If you could just take a couple of moments to take a look at this poll question and answer it for us, that would be fabulous. We'll give folks a moment to do that.
There's a 73% of votes.
All right, thank you very much. A high percentage of you answered this poll question. We're going to reveal the results in a couple of minutes. Or we're sharing it right now. So interesting. You, almost overwhelming majority of you are going to report on your measures for 2017. That's great. We're going to add just one more poll question, so thank you for your patience. Please select one of these answers. Thank you for voting on that. We'll display the results now. Great. Well, it looks like we have the right set of attendees, folks that are interested in either partial or full participation. Thank you for your answers. And give us just a moment and we'll jump into a couple of questions that have come from you. Okay, we'll start at the top. We've got about 10 minutes left, so I'll cover as many of these questions as we can. First question, when is version 9.3 available? I was updated to 9.2 in December, and 9.3 was not mentioned. Great. Okay, we have the links available this week for 9.3. Those can be found by logging in. to our website. You can automatically download those tomorrow, or you can give our client services team a call if you need some assistance in upgrading. Okay, will there be an extra charge for version 10 to submit data? The answer to that is yes. We do expect that version 10 will include some new charges, and we'll look forward to publishing those in the next few months. What are the practical differences between manual and automatic methods of data entry on registries? For manual entry, like with PQRS Wizard, you may have to keep track of patients by hand and then fill out forms for those patients. Then enter that data manually into a registry system. Automatic entry generally means that the data will be pulled from the Amazing Chart system automatically instead of you having to do it after the fact. We have relationships already with many of the registries that we showed in the webinar, so we believe that by and large you should be able to take advantage of an automatic solution. Okay, the next question. If you are assured no negative result if you do the test mode, if you choose to do a harder method and try but don't quite make it, are you saved from getting a negative result because you tried and just don't get any positive adjustment? Or can you still have monies taken away in 2019? Well, there's really great news. So the answer to that question is, if you report on just one quality measure, you will avoid the negative adjustment. In fact, it's our belief that your performance on that measure will not even be scrutinized. You will check the box, receive 3 points for quality for the one measure, and you will not suffer any negative adjustment. No positive adjustment either, but no negative adjustment. If you choose to go to the partial mode and your performance on all the measures you've chosen are not stellar, that still won't matter either. Just the fact that you've reported that you've met the requirements may even qualify you for some kind of upward adjustment. You will definitely not see a negative adjustment by doing test, partial, or full, of course. Number 6, can you note where to find the benchmarks? Yes. The benchmarks are found on the qpp.cms.gov website. We've got that in our educational materials. And there are documentation for all the published benchmarks. I cannot certify for you right now if all 243 measures that are available under the program also have a benchmark, but by and large, what the measures you are probably interested in have published benchmarks. Okay, here's a really important question. If we want to report a full year in 2017, waiting until Q3 in 2017 to upgrade will be too late to collect data, won't it? The answer is no. We will begin collecting data for you on the first day of 2017. The new version of software that's coming out would enable you to successfully report those numbers to CMS using all the latest and greatest clinical quality measure determinants that the ONC has just published, which is why our recommendation for folks that want to go the full path, engage with a registry now. They can put the connection in place with Amazing Charts and give you the tools that you need, similar to the dashboard I showed you in today's presentation, so that you can track continuously throughout the year. So if you are looking for the full path forward for 2017, you'll definitely want to go that route. All right, we've got time for one or two more questions. Let's see. We've always submitted claims for our doctors individually. When talking about 20 cases per measure, does that mean per individual or per group? So the measure requirements are as follows. If you're reporting as a group, the case measurement applies to the group. If you're reporting as an individual, it applies as an individual. So the same measure applies whether you're an individual or a group. The case minimum is 20. Okay, someone's looking for the link to the past webinar. That's also online under our MIPS MACRA resource page under the section called videos. The first video you'll see is the MIPS 101 webinar that we conducted a few weeks ago. Very interesting, timely question. If Obamacare is repealed, will this still apply? The answer is yes. The MACRA initiative of 2015 was actually passed by the Senate into law with strong bipartisan support. It came along with the repeal of the SGR and essentially replaces the SGR going forward. So this is the only method that Medicare payments can be applied going forward without an act of Congress to repeal MACRA. ACA and Obamacare, totally different story. Okay. Can we explain the benchmarks and how the deciles work again? Yes. So quality measures are submitted from all over the country annually, and CMS determines what a benchmark should be for that measure. So say the benchmark for controlling hypertension, an outcome measure, nationally is 66%. If your practice measurement turns out to be 70%, then you're clearly doing above the benchmark. And the benchmark will determine, and your score will determine what decile you fall into. The deciles determine how many points get applied for that measure as part of the scoring for quality, and then of course the overall composite score. So the benchmark is how are you doing it nationally against your peers, and the decile is where does that have me fall in the continuum of points I might receive for a particular measure. We will send you the full deck, as I mentioned, and you'll have access to go back through it. Please feel free to call our product support people if you have questions particular to your practice, to how to find a registry, to what measures you might want to look at in your practice, to do planning for an upgrade at year end, any of the above. We're here to help you, and we're happy to hear from you. I'd just like to thank you all for attending. I will share that we received over 400 registrations for this webinar. We were really excited about that. It shows a strong interest in the community. We'll continue to publish as much education as possible, and please keep in touch. Thanks.